I've had some experience with Serenator kind of in the beginning. Michael, what would you say, like, from the crossing profile of these devices? Are they compared to a POBA balloon? How much bigger are they? Do you have difficulty delivering it down to a distal tibial or below the ankle?
Yeah. I mean, the way I think about this, short answer is yes, they are bigger than a regular balloon. But the expectation that we have in using these specialty technologies is your patients are going to get more from them. So it makes sense that they might be a little bit more challenging to deliver. Historically, I'd say 4 years ago, I was using a lot of orbital atherectomy for my tibial cases. And I found that using a micro device, passing it just a couple of times just to make a pilot channel would facilitate delivery of any of these technologies, whether it was Serenator or Shockwave or anything like that. And I've continued to see that. Although I don't do as much atherectomy as I may have in the past, I think a little pre-dil. Most of the time, all of these get a pre-dil with a 2.0, just regular PTA balloon, taking the low pressure up and down just to make that pilot channel. And I don't really have any issue. And you're absolutely right. Serenator can get delivered all the way down to below the ankle. I'm really looking forward to Ted Gifford's paper getting published looking at the results of specialty balloon using the Serenator for the treatment of BTA arteries.
Nice. Yeah, exactly. I mean, it's funny. It's a little bit like you need a vessel prep for the vessel prep.
You have to pave the road.
You have to pay a little vessel prep for vessel prep, and then a final delivery, but it's true. That was my experience early on, which kind of hindered us in my lab a little bit, is my patient population, diabetics, really shitty tibials, subtotal occlusions, etc. Like trying to get even sometimes just getting a regular balloon across was really hard, right? And then we kind of had to prep and then to get another device. But I know, Jay, you mentioned that they have a more smaller, lower profile version now. And again, those all come, the max length is 120, right? That's good.
I've been using that a lot more now too, especially for a lot of our BTA type stuff too. I'll tell you that you can use that very commonly without any type of pre-ballooning. That was always the Achilles heel before too. Like you said, you got to prep to prep, and it just slows you down. And even with the retrievable stent technology, they had recommended ballooning first as part of the IFU before delivering the device. So, ultimately, as these devices keep getting developed and iterated, ideally we want to get more efficient so we can cut down the number of steps that we have to do and to get these cases. I mean, they're long cases to begin with. So the last thing we want to do is use a ton of product.
I think like the one guiding piece of evidence that we have for all these specialty technologies, is their principal studies have all demonstrated that they're all safe, right? They're all safe. And that the hesitancy that most people have when they put something new in their hands, the Serenator, the metallic strips, the concern that what if this is in a subintimal space? Is it going to perforate the artery? Or, when you look at the spur in and of itself, it almost looks like a medieval weapon or torture device.
Gladiator. Yeah.
Over and over, we've seen that these technologies are first and foremost safe for our patients.
The difference with serration angioplasty is you don't really need to go to high atmospheres, right? So the balloon itself too, you can do very low atmospheres, like 5-6 atmospheres, and really get good luminal gain. And I mean, most people don't need to max it out at 10 atmospheres. So it's a low pressure angioplasty, and the serration is doing the work, right? That's all that point force is being applied across the lesion. So I think that's important to understand that, we're not trying to do high pressure angioplasty. You get a balloon rupture, then you end up with a perforation.